Hello, and thanks for tuning into our webinar today. Today, we're going to talk about how you can stay connected to your circle of care through COVID-19 using your SecureMail account to communicate with your different practitioners in your circle of care. Just before we get started, if you haven't set up your audio this way, you probably can't hear me. This is the recommended setting. If you go to your audio tab and your GoToWebinar panel on the right of your screen, you can click here. You can also dial in and listen along through your phone. That's not necessary if you can connect to your computer. And if you have it set up like this, you won't be able to hear us. So make sure you do this one. With me today is Mark Ayer, Director of Customer Operations. Mark has been working with patients and clinics to support the use of SecureMail for quite a while. Mark, welcome. Thanks for joining us today and helping demonstrate the use of SecureMail.
Hey, good morning, Jeff. Thanks very much.
So we'll dive in because we do want to respect our time today. But here's kind of what we're going to talk about. We're going to talk about staying connected. I think now more than ever, we've realized that the way that healthcare is provided typically is quite outdated. We don't need face-to-face communications all the time. Certainly in many healthcare scenarios, you're going to need to see a provider that can lay hands on you and, sort of feel something. I was talking to some optometrists this week and they can't really provide their care remotely. They can use SecureMail to provide updates. If you needed to, I forgot, or I lost my prescription for my eyeglasses, they can send it to you that way. But some types of practitioners, it's difficult for them to provide care, but they can still communicate with you in other ways. And we'll talk about sort of what that does for you and what that does for them. We'll have a little bit about, what do clinics say about it, because, it's important for patients to know that there's benefit. And one of the things we're going to talk about is patient use cases. And as you expand your use of SecureMail, we'll talk about what patients are thinking about, what patients want to do, and that sort of thing. And then, of course, we have our draw at the end of all this. So stay tuned in case you are the recipient of a gift card. So how does SecureMail keep you connected? So there's a number of different ways that SecureMail works, so you can use it. And we'll go through a little bit of a demonstration afterwards. If you've used webmail before, and if you've used your SecureMail account at all, hopefully it's been easy for you. That was certainly the intent of how it was designed, and that's most of the feedback that we've gotten. But what do you do with this thing? We do get people who believe that SecureMail or Brightsquid is a arm or a function of their clinic specifically, and not a tool that they can use to manage your healthcare. So the purpose of our discussion today is to help you understand that it really is a tool for you to manage your care. You can discuss treatment results, check in virtually. I think now more than ever, we're all a bit nervous about going to the doctor's office. And in many cases discouraged by the clinic. So what do you do? Hey, things have changed. Maybe from a mental health perspective, people are feeling more uneasy nowadays. I know certainly me, I am on certain days about how things are going. There's a lot of uncertainty in the world. It's entirely appropriate to check in using SecureMail in that sense, because what it does for you is it provides an asynchronous connection. And that means that you don't have to align schedules with your providers. You don't have to call and say, I'd like to talk to the doctor about this and go and find a time. And really, as you're feeling things or as things happen, you can send a message with the expectation and understanding that you're not going to get an immediate response. But let's say it's 9:30 at night, the clinic is closed, but you have a question or you're feeling a certain way. You can type a message and SecureMail send it, and your clinic will get it the next morning, and they can respond at that point. So you don't have to wait to try and get a hold of them. You can ask your question and have it dealt with in turn. Now, you can take a more active role in your health and well-being with information. Healthcare information is the currency of healthcare. There is no way to provide healthcare without information. And as a patient, it is critically important that you have access to that information, because your healthcare information actually does belong to you, because it's about you. And having that understanding and that access gives you a lot of power to be able to share it with different providers, and help you understand it because you can refer to it. If you're like me, I've been using the healthcare system for over 40 years, and there's still a lot I don't understand. Obviously, it's not my day to day, and when you come into episodes of care, it's great to have something to refer to, something you can look back upon. And SecureMail gives you that record in the palm of your hand, in your pocket, in your purse. You can just pull out your phone and review what was discussed, and it allows you to be a more engaged, more active patient. There are several benefits to that. We know that people who have better access to their healthcare information are healthier because there tends to be better treatment adherence. We don't have to worry about, oh, I've forgotten what it was we discussed. And the research around that shows somewhere between 30 to 80% of the information you receive in a healthcare medical appointment is forgotten by the time you're in your car. So this helps you by collecting information this way. This helps you keep informed and have those reminders about what you should be doing. Because now we can keep in touch about social distancing, send a quick message, an update. If you happen to have a chronic condition that is being managed, anything changes, or even if something doesn't change, that's often helpful information for healthcare providers to have as well. Hey, everything's going great. I feel awesome. Let's, and they can might write back and say, okay, great, let's check back in a couple of months. I had one of those interactions myself this week. And files and records can be sent instantly. This is something we're going to talk about, but what we see and what happened, we didn't actually expect it, and clinics didn't expect it, but patients, us as citizens, humans, we understand how email works. And so in healthcare, sometimes there's difficulty mapping the idea of email. Now, SecureMail isn't technically email, but it works and looks and feels just like it, as I'm sure you know, and Mark will demonstrate here in a couple of minutes. But you can send files. So nobody actually expected patients to just start sending pictures into clinics and saying, hey, here's a picture of my kid's rash, or I stubbed my toe last week and this is what it still looks like. Is that normal or okay? And it's actually really helpful from a diagnostic standpoint. You don't have to necessarily get care. Specialists, neurologists, especially things like seizures, tremors in the hands, that's stuff that can't be scheduled into an appointment. So if you have an appointment for seizures or tremors or something like that, something episodic, you can't schedule it and say, okay, I'm going to have that happen at the appointment. So we do have clinicians, we have specialties that will ask patients, we'll talk to them and say, hey, when it happens, if you can, have somebody record it or record it with your phone on video and attach it to a SecureMail message and send it to me. So it allows you to be more engaged and involved. It also allows you to support your clinician team in providing great care. Now, when we talk to patients, and there are over 100,000 patients using SecureMail, so we've got a lot of data in terms of how people like to use it. Now, all of that data is collected in total privacy. We're not asking people to reveal any private information. That sort of thing is protected. So, but what we do know is that most patients want to connect with 3 or more providers using SecureMail. And that's why in the directory, you can go and search different providers, look up location, look up specialty or profession, and look up the clinic name and see if you can find other clinics that you work with. Now, not all clinics are on, more and more added every day. We add about, I think Mark, you can confirm, but somewhere between 500 to 700 more clinics every month come onto SecureMail. I think it actually might be more than that now. But when we ask patients to say, hey, what other specialists what other providers would you like to work with? Here's the list, and it's ranked in order. Here's the kinds of providers that people want to connect with using SecureMail. And when we get down the list, we get down to even the chiropractors and physiotherapists. About 40% of patients want to connect with those providers. So it's still a significant proportion of people that see value of having this centralized. We'll talk about it a bit later, but if you're in Alberta, the SecureMail can be tied into your online health record that you can access to view some of your health information. And now you can share that information with other providers through SecureMail, because your SecureMail account is actually right inside your My Health Records account if you have access to that. And if you haven't yet, we do recommend that you sign up, and we'll show you how to do that towards the end of the presentation today. So with that, the other thing to mention, and we'll give you a good sort of carrot to help any providers that aren't on the system yet at the end of this presentation as well. So stay tuned for that. But clinics that use SecureMail do see benefits from an efficiency and effectiveness standpoint. So here in Calgary, where we are located, we have one clinic that is, they say they've increased their ability to address patient concerns by 18%. So a 20% increase in their capacity to treat patients. That has tremendous benefits for the healthcare system. If we could get clinics to adopt at that rate on a large scale, then you see maybe a 20% increase is unreasonable. A lot of the research I've read points to about a 10 or 11% increase, sort of as a standard. So if we could increase the capacity of a primary healthcare system by 10% by introducing secure email communication between clinics and patients, we would see tremendous benefit across the system in terms of cost savings, in terms of wait times. We get people seen faster, we have better access to care, and the cost goes down because complications aren't developed as much. So, we have other clinics. We work across North America. People say things like, if I didn't have SecureMail, I'd need two of me, because that clinic in particular actually saves 75% of the time it takes to process communications between different providers. And when they add that up, they actually save a month of time every year that they were wasting. Now that's working time. It's not 30 days at 24 hours a day. It's 8 hours at 20 days. So they're actually way more efficient and have more capacity to address patient concerns rather than filing paperwork and printing off letters and stuffing envelopes. They just attach files to a message and send it off. And in that sense, we have clinics that say Brightsquid is the best solution they found for sharing large files and compliant. And that's what SecureMail was built for, was to send compliant files. We were actually founded by a pediatric radiologist in Calgary who found it impossible to share large images, so X-rays and CAT scans and that sort of thing, with experts around the world that he needed to consult with. And all he could do was burn them onto a DVD. And even still, there are clinics that are doing that instead of using SecureMail for some reason. And it's number one, it shows up broken a lot of times. It shows up unreadable because the file format isn't proprietary and they don't have the right systems. And it shows up late. So a lot of times what our founder found was that he had to move on and make a decision before getting the proper opinions. So let's take a look at a couple of use cases and see how SecureMail fits into your interactions with the clinics that you work with. So this is now, if let's say you went to your family doctor and you had a headache, and they said, you know what, I'm gonna have a neurologist talk to you about this or take a look. Now, there's a couple different ways that can happen. They can send off a referral, which is called like a transfer of care. So now the specialist is going to be responsible for this episode of care. Or what's becoming more popular is called an e-consult. So they can actually send a message to a specialist and say, I have this patient, here's the presentation, here's their feeling, what do you think? Before sending you for a referral that might take 6, 8, 10, 18 months to get to see. This can help us get answers a lot more quickly. And now the specialist can respond to that, attach a report. This might happen for an e-consult request. This might happen after you've gone to see them. And they can actually, because of SecureMail, they can send it to you and your family physician. So you don't have to wait to have to get into your family physician to get interpreted results. You get the result right away. Now, something like headaches, that are perpetual, persistent, that can be concerning, especially when you're going to a neurologist and, you think about, oh my gosh, what's going on in my brain? Is it bad news? The sooner you get that information, the better you're able to sleep at night. So we're actually helping you get the information you need more quickly and, alleviating some of that stress and anxiety that does pop up. Now, what can happen then is you have questions for your family doc or the specialist, you can reply. The family doctor might have other ideas because they're more familiar with your entire history, and they might help you identify some other treatment options. Now, if you want to talk about, complex or chronic diseases, SecureMail is a great tool for that. 30 to 40% of Canadians, and I believe the numbers in America are the same, have some chronic condition that they're managing on an ongoing basis, a condition like diabetes, If you look at the recommended course of care, you end up with 12 different providers you're working with at any given time. So, like we talked about at the beginning, touching base with your clinician is a great way to use SecureMail. It's a great way to help, you engage on an ongoing basis, keep your care team informed, keep you informed of any changes that should be happening in your care before waiting to, you're able to get in and see them face to face. As we said, it's much more convenient for both sides of the equation to have a communication over SecureMail because we don't need to look at our schedules and line them up. From a patient perspective, the average time for us to go to a clinic is an hour and a half out of our day. Even if the appointment is just 5 minutes, the average time I think is about 12 to 15 minutes, depending on where you are. In Canada, it's actually a little bit higher than that on average, closer to 18 to 20 minutes. But your travel time, your waiting room time, all that stuff adds up. From a clinic perspective, they have other work that they have to do to get things ready, especially now they have to clean the exam room, right? They don't have as many exam rooms operating because of that. They don't want to have to clean them all the time. So there's a lot of work saved if we can conduct this episode of Care Over SecureMail. You have a question at 9:30 at night, the doctor gets back to you on their lunch break the next day. And it takes less than 2.5 minutes on average, according to a bunch of research, for clinicians to respond to you. So in this case, you've written into your family doc, you have a question, they respond, you can read it. If you have any, maybe they say, hey, send me the readings from your blood sugar monitor. What's your Fitbit? Send me your Fitbit data. Have you been exercising? That kind of stuff. You can do all that. Or, hey, have you been doing this? Have you been eating this? Have you been taking your medication? All that stuff can be conducted this way. Now, they might want to focus and ask a few questions at once, or they might say, hey, based on what you're saying, I'd like you to come in, or maybe we'll have a chat on the phone. But all of this can be started and set up using SecureMail, and we've cleared a bunch of stuff out of the way. We have clinics that by communicating up front, maybe sending forms and saying, hey, fill out this questionnaire before your appointment. They've cut their appointment times in half, which allowed them to double the number of patients they can see in a day, which decimated their wait time. So their wait times actually went way, 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 way down. With all of that, Mark, I'm gonna turn things over to you, so you can tell us about sending files to your providers, attaching things, that kind of stuff, and looking for other providers in the directory, because as we know, patients want to find. We all want to sort of centralize our communications in one place. A lot of providers will have systems they use, but that introduces something called portal fatigue for patients. If a diabetic and I had to work with 12 different providers and they all had a different messaging system that they wanted to use, that would be tough for me to manage and remember. And it's actually adds work and burden to the patient, where if everybody can just get on SecureMail, and like I said, we're growing more and more. Mark, you probably know for sure, there's about 60,000 clinics on SecureMail now. So the chances of your provider coming in is growing every day, but you can always invite them, and we'll talk about that later. But Mark, you go ahead.
Thanks very much, Jeff. So I just turned on my screen broadcast, so everyone should be able to see my screen. And if you've used SecureMail even just a little bit, it should look very familiar to you. I'm at the SecureMail inbox. I'm logged in as a patient named Adam. And here are the messages that Adam has received from his practice or from his medical provider recently. This is a very common example, a use case where the patient has received just a check-in from their doctor's office. This looks like a follow-up message that came from the doctor's office with regard to some acid reflux concerns that were addressed recently. And the doctor, like Jeff had mentioned, is just sort of checking in remotely to see how things are going. Now you'll notice that it's not actually the doctor that sent this message. It's a staff member within his or her practice. In this case, her name was Clara. This is also very, very common. We find that in most cases, it is the front office staff, the medical office administrators, and what have you, that are communicating back and forth with their patients through the SecureMail service, in much the same way that they use the telephone. I mean, when you talk to the practice over the phone, you generally talk to a staff member. It's less likely you're talking to a doctor, but that does happen sometimes, of course. But at any rate, what I wanted to talk about primarily today is getting away or using more secure mail functionality and being more active in the way you use the secure mail service. In this example, Adam here, the patient I'm logged in as, has received this message, and it's somewhat passive, where he's receiving information, and when and where he's prompted to do so, he may send a response back to the doctor's office with an answer to a question. But you can be more active in your use of secure mail. I mean, Jeff talked about some of those examples a moment ago. Excuse me, one second. Sorry, I had a bit of a frog in my throat there. I hope I hit the mute button before my cough came resounding through. Um, okay, so in this example where I received this message from the Fauchard Clinic at Southland, which is my current practice, I can, of course, reply to the message and send a response back to them. If I go over here to my directory over on the far left-hand side of my screen, I can actually take a look at all of the different practices and individuals that I've interacted with recently. So there's the Fauchard Clinic at Southland, another Fauchard Clinic at West Hills, and then Röntgen Neurological Services. These are all practices that I've interacted with recently. And if I select this one, I can look to see who's in this practice and make a decision as to whether or not I want to send a message to them. There's a send button right here, and I can look more closely at the profiles of the members of the clinic as well. But let's say I need to find another clinic, someone else who I've never interacted with on Secure Mail before. I may have been invited by the Fauchard Clinic or Röntgen Neurological Services, but I'm not restricted or limited to only using Secure Mail with those practices. From within the directory, there's a global search option up here that will allow me to search more broadly for other Secure Mail users. As Jeff mentioned, there are about 60,000 providers on the service. Not every doctor in your jurisdiction is necessarily going to be here, but Jeff will talk about that when I turn the demo back over to him in just a few minutes. But I have a doctor named Chapel. She's my, I don't know, some sort of doctor. So I just searched up here the first couple letters of Dr. Chapel's name, and the search results come back right away with Christine Chapel at Brightsquid Medical. Now, when I select Dr. Chapel here from this list, or actually, Christine is a support member within the practice, to be clear, I can immediately see that I've got this practice. So I can see the phone number and the address, and I can verify that this is the practice that I'm actually looking for. If we go in and click on the clinic name here, we can see all the members of this practice. So there's Christine, Sydney, and Leonard. That reminds me that I've got the right place. I mean, there may be a dozen Brightsquid medical systems or Brightsquid medical practices on the Secure Mail service, but this is the only one that has my doctor, in this case, McCoy or Crosby or whatever the case may be. So now that I know that I've got the right practice, I just click the Secure Mail button up here to compose a message to that new practice. And again, I'll remind you that I've never interacted with Brightsquid Medical before. I've just logged into my Secure Mail account, found the appropriate practice that I want to communicate with, and I can now send them a message. So when I'm sending the message, I'm just going to type the subject line here, which is test. I don't feel very creative this morning. And then the body of the message would go here. So here's where I would type, the information. So you'll excuse me for the lazy typing here. I'll correct my spelling mistake. So I could say anything I wanted to here. But most importantly, I can attach a file that I want to send to this practice. Now, I'm logged in on a Windows computer using my Firefox or Chrome web browser, it looks like today. But I could also just as easily be logged in on my mobile device, my iPhone, my Android, my tablet, or what have you. And when I'm using a mobile device, when I select this browse button here, I can actually use the camera on that device to take a photo of a body part, a rash, as Jeff mentioned, or even scan a document that I want to send into my doctor's office. Now on a desktop computer like I'm using right now, when I click browse, it just opens up a little browse option and I can select files that are on my computer. So I can select a photo or a PDF document or any type of document really that I may want to send back to this practice. So when I click open, those files will be attached. And then as soon as I click send, as you'd expect, they'll be delivered to Brightsquid Medical and they'll be able to view and download all the information that I've sent to them. Now, before I send this file or this message, I want to just double check to make sure I've got the right file here. So I can actually preview in this case, the PDF document that I'm sending over. And in this case, it's a document that I've scanned with my phone where they've asked me to fill in a survey and send it back to them. So this way I know I've got the right PDF and I'm not sending them something inappropriate. I can do the same with a photograph. In this case, we've taken a photo of a baby's foot. There seems to be some sort of a rash there. I certainly can't diagnose that myself, but by sending it off to my doctor, hopefully they can provide me with some feedback or an opinion as to how to manage that situation. And that's really all there is to it. I can click send. The notification is sent. The little green success bar appears in the bottom right-hand corner. So I know that it's good to go, and I know that the information is very shortly going to be in the hands of my medical provider. And that's really what I wanted to show today. I think I'm going to wrap it up here, and I'll turn it back over to Jeff, who I know has a couple more slides he wanted to share. So Jeff, are you still with us?
Yeah, thanks, Mark. Let me get back in here and give myself something. Here we go. So as I mentioned, in Alberta, you can connect your SecureMail account to your My Health Records account. If you don't have a My Health Records account, you can go to this address, myhealth.alberta.ca/myhealthrecords. I think if you just type in alberta.ca/myhealthrecords, it will redirect. There is a bit of a process to get set up, but it's an identity verification process. It's very important. And then you'll be able to access SecureMail through your My Health portal in the same place you access a lot of your information from your test results. If you did by chance have to get tested for COVID-19 or wanted to, your COVID-19 test results will show up usually about a day is what we've seen before you get that call saying you're negative or positive. So lots of great reasons to get signed up for My Health Records if you haven't done that yet. We will. Oh, sorry, we missed one other slide. I mentioned that we would give you sort of a gift for your clinic. So clinics that you want to get on the system, right now, any clinic can sign up and get 2 months free. They can go to Brightsquid.com, go to our SecureMail page, click the sign up button. If they use this 2 months free, they will get a 60-day trial, basically full access so they can communicate with you. Clinics have 2 different options for how they use SecureMail. They can either subscribe, and that subscription is $40 a month, so it's not a huge cost to anybody. And that gives them unlimited access. They can invite and communicate with all their patients. They can invite other clinics so they can have those, we talked about e-consults, faster, better, easier referrals, that sort of thing. Or there's free access. Free access gives clinics 20 messages a month that they can send. The big difference is they can't invite anybody else. So they can't actually communicate with patients. They can only interact with clinics that are existing on the system. This coupon code will give them free access. There's no obligations. They will have to put in their credit card because we use that as part of our identification process, so we know that it is actually that clinic. There's some things we do behind the scenes to match those up. But after the 60 days, they don't have to pay us if they don't want to, but it just gives them a taste of it. You can have the interactions with you want with them, and it gets them on the system for you. We do have a question about on the system. We give you the option to give us the information for your clinic, and we'll reach out to them. Some clinics, especially right now, because they're inundated with phone calls, are not very responsive to calls from companies who aren't looking to have an appointment with them. They're focusing on that. So right now has been a tough time for us to get through to clinics and invite them. You are welcome when you reach out to them and say, hey, I'm using SecureMail to be better engaged in my health, take better control of my health and wellness, and I'd like you to get onto, here's a code I got for you to get 2 months free, so we can try it out and see how it works for us. So it's tough right now for us to get clinics invited. We have had some success getting through, but not all clinics are responding to us, which is understandable right now because given the time. But there's a greater likelihood they will respond to you and help you take advantage of the sort of, well, I won't call it healing power, but the empowering power of Brightsquid SecureMail. With that, we are at the end of things here. We do have a winner for our gift card. Our winner today is Catalin. So we'll reach out to you with your $25 gift card. Thanks for tuning in. And Mark, do you have any final words before we move on?
The only last thing I want to say is if you ever have any questions about how to use SecureMail, what you can do with it, types of files you want to send, please always feel free to contact our help and support department at support.brightsquid.com. And anytime you logged into your Brightsquid Secure Mail account, there is a little question mark icon in the top right-hand corner, and you can contact us there through live chat, email, or phone call.
Yeah, great. And I will point out quickly, we do have some questions in the window about My Health records. If you go to that page, alberta.ca/myhealth, you there have support. So if you have questions about what you can access, what's showing up, what's not showing up, you can always reach out to them and they can help walk you through that and troubleshoot any issues you might be having. Anything related to the secure mail, we will, like as Mark said, always help out with that. As any user on our system, you always have access to our support team. So with that, we're at our time. I promised we'd respect it. Thank you so much for tuning in. Hopefully it was useful. And again, any questions, always reach out to us. And if any clinics that you work with have any questions about what they can and should be doing with us, certainly they can give us a call as well. Thanks, everyone. Have a great day.